Most people think that breast cancer only happens in women, but men can get breast cancer too. And while it is rare, it can often be serious because it's diagnosed later. In honor of Breast Cancer Awareness Month, let's discuss this often overlooked issue. Hi, I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician, and today we'll discuss breast cancer in men, who's at risk, what signs to look for, and why awareness can save lives. Although much less common in males compared to females, males can get breast cancer. Male breast cancer makes up less than 1% of all breast cancer cases in the US. This translates to about 1 in 1,000 men who will develop it in their lifetime, compared to about 1 in 8 women. While this number may sound small, in 2025, it's estimated that among men in the US, there will be 2,800 new cases of invasive breast cancer and 510 breast cancer deaths, which really is not a small number. Many men don't realize that there is a small amount of breast tissue behind the nipple where cancer can develop. And because they don't realize this, symptoms are often ignored until the cancer is advanced. Several risk factors can increase risk of developing breast cancer. The risk of breast cancer increases with age. Most male breast cancers are diagnosed in men over 60, with a median age around 69. And the reason age matters is that cancer often results from an accumulation of DNA damage over decades of years. And this leads to a buildup of abnormally growing cells, which can then result in cancer. Family history and genetics can also play a role in breast cancer, just like they do in females. Men can also develop genetic mutations that increase the risk of breast cancer. BRCA1 and especially BRCA2 mutations can significantly increase their risk. In fact, up to 40% of male breast cancers are linked to BRCA2 mutations, which is actually higher than that in women. This is why genetic testing is recommended for all men diagnosed with breast cancer. Hormonal factors can also play a role. Higher estrogen levels increase the risk, and this can occur with obesity, chronic liver disease, Klinefelter syndrome, or certain medications that can alter your hormone balance. Radiation exposure can also increase risk of developing breast cancer. Men who've had radiation therapy for things such as Hodgkin's lymphoma face a higher risk later in life. Radiation therapy damages DNA in breast tissue cells, and even though the amount of breast tissue is small in that area, those cells are still vulnerable. And over time, that damage can lead to mutations that then trigger cancers years and decades later. In men, most breast cancers start in the milk ducts, called invasive ductal carcinoma. A small number, less than 2%, will begin in the lobules. Invasive ductal carcinoma is also the most common type of breast cancer in females. Breast cancers are further classified based on the overexpression of certain receptors on the cancer cells, including estrogen, progesterone, and HER2 receptors. And this just helps guide treatment therapy. Most male breast cancers are hormone receptor positive and HER2 negative, which means that they respond to hormone blocking therapies like tamoxifen, which is also used in females too. Common signs or symptoms to watch for include a lump or swelling in the chest, usually painless, changes in the nipple such as inversion, discharge, or crusting around the nipple. Skin changes like dimpling, redness, or scaling around the nipple or breast should also be evaluated. Many men also experience a benign enlargement of breast tissue called gynecomastia. This is benign, so it's not cancerous, but any new lump or persistent change should still be evaluated by your doctor. Because breast cancer is unexpected in men, it's often diagnosed at later stages. But here's an important point. When men and women are compared stage for stage, survival rates are similar. That means that early awareness and detection can truly save lives. We also see racial disparities. Black men have the highest incidence and mortality among men with breast cancer, highlighting the need for better screening, access, and awareness in all communities. So even though male breast cancer is rare, it's very real, and most important, it's treatable when found early. If you found this video helpful, make sure that you like and share it with your friends and family, especially with the men in your life. And don't forget to subscribe for more health-related topics. This October, let's remember that breast cancer doesn't discriminate. Awareness saves lives in both men and women. Thanks for watching, and remember, your health is worth protecting. Talk to your doctor about getting screened for breast cancer, and make sure your friends and family do the same as well.